Hello, everyone. This is Cole from the American Journal of Healthcare Strategy, and here with me is Poojan, a corporate administrative fellow with WellStar Health. Poojan, please introduce yourself.
Hi. So my name is Poojan. Like Cole said, I use the she, her pronouns. I graduated with my MHA from UNC, UNC Chapel Hill, and I am now doing my fellowship at WellStar. I was also an intern at WellStar, so they fortunately wanted me back, and here I am. And I'm probably in my, I think, eighth month of the fellowship. This is a year-long fellowship, and I couldn't have had a better time. I'm still having a great time. So yeah, knock on wood on that.
That's awesome. We love it when our fellows tell us that they've had an excellent time at their program. And then we were talking a bit before this started about the sports experience at UNC. I just want to ask, was UNC, and if you're not comfortable with sharing this, that's okay. Was UNC your first choice?
UNC was it. So I wasn't that big of a sports fan. I didn't really know its presence. I knew it was good, but I had recently just moved to this coast, being the East Coast, and I just wanted to be close to my family because I had experienced being away from them during undergrad, and I was just like, I think I'm done. I think I need to be closer to home, closer to people who I'm familiar with. And so UNC being the top ranked program that it was really close to home, and it also offered me enough scholarship to go and not feel bad about going out of state. So I was very fortunate for that. So UNC was definitely my first choice when I was applying. Also because Alabama, I wasn't familiar with the state. I know of the state obviously, but I don't have family there. I don't have any connections to the state.
Was that your second choice?
Alabama, yeah, it's a place that I considered, but because also it was highly ranked, and
Was it UAB? Yeah,
UAB is
we
a
just had a video today on UAB. Excellent program.
yes,
Yeah.
and they're ranked number 1, and I have a lot of friends from there now, and they're literally so amazing. So I wish I would have gone there, but I'm really glad that I actually went to UNC because it was perfect for me. The drive was great, and for me, it was more the location because I've learned that education is somewhat similar everywhere.
Yeah.
It's the people that make it or break it for me, and I'm learning that a lot now too. Is I pick places and I pick my next steps based on people rather than how ranking wise how it does and how big the company might be, etc. So UNC
Yeah,
definitely was.
I had the same experience. Me and my cousin, my one of my cousins went to Harvard, the other went to Penn, and he's like, "Oh, don't go to Harvard, don't go to Boston." And so, seeing them talk about it is very interesting, but it really does come down to the community that you kind of enjoy the most. And I've experienced both Boston and Philadelphia, very different communities, and I think it's just whichever one you kind of want to be involved with. I mean, probably same thing with Alabama versus Charlotte. I mean, excellent communities
Yeah.
for sure, with wonderful students. I've met students at both that have been excellent, much like yourself. And so, one of the questions, I guess, initially, where is your family? Are they in the Georgia area? Are they in North Carolina?
Mhm. So before I was starting UNC, they had recently just moved to South Carolina. So they're on the coast. They're in Georgetown,
Oh,
and
nice.
so it's far away to where I don't have to see them every day, but it's close enough to where I could go in a quick drive and one day trip.
That's excellent.
Yeah.
That's really nice. And so you started off. We were talking a bit before as well. At Berkeley, you did your molecular and cell biology. And you did a lot of work as well in terms of the course facilitator in healthy sexuality, the sexual health education program, the clinic lead. You were really on a roll for pre med. You were probably heading towards the top, being a top candidate for pre med, which is excellent. And then you chose to not go to medical school. Why is that? What made you have that change?
So it kind of hit me all different ways. So first it hit me of like soul searching wise is, do I really want to continue education for that long? I don't think I had the endurance to keep going that, a lot of med students need to have. I definitely think I could have made it, but I just don't think that I would have been happy. And then secondly, it was the familial bond that I needed. I always want to have that time and energy for my family and my permanent relationships rather than my work. And so that was another thing. And lastly, I was really good at management. And, through these experiences, especially the clinic lead that I was placed into, my original job started as like a clinic. I was basically giving care and HIV testing and all of these different things. And then I got roped into being like the clinic lead, basically the supervisor of everybody and my peers. And that was really fruitful. I really liked doing the back end work instead of, the frontline work. And I never realized that I would enjoy it so much. I've had a lot of management opportunities with like my family business and whatnot, but it's never something that I took seriously because I never knew it existed. And I think I was telling you a little bit before, I'm an immigrant, so it was very limited availability for me. I was always like, okay, you can either be engineer, a doctor, or a lawyer. And I didn't realize that there was such thing as healthcare administration out there until I graduated from Berkeley and I had just really said, no, I am not going to medical school. But then I was like, what else am I going to do? I can't just sit around. I have to be doing something because that's just the person I am. I'm all constantly go, go, go. So that's when I started Googling. It's like, I think I literally Googled healthcare jobs, but not doctor. And so
That's
I,
great.
I didn't want to be a nurse. I don't think I was capable of giving that level of care. Nurses are cut from a whole different cloth that
Yes.
I just kudos to them, but I don't think I could do that. And healthcare administration popped up with all the phlebotomists and all the techs and whatnot. And I was like, what is that? So I did a little bit of searching, again, Google searching. I don't have any people at this point that I've met. And that's how I fell in love with this. And the curriculum is you're learning about policy, you're learning about public health, and you're learning about the hospital system and how care is given. You're just not giving the care. And you're still taking care of people, but you're taking care of the people who are giving care to patients.
Yes.
And so that's something that really drew me in is I want to do something so worthwhile that I feel like I'm contributing to society in some way. But I also loved that so I use this analogy as with physician, if I were to be a physician, I would have a one-on-one contact with someone and change their lives in that way. But being in healthcare administration, I think I'm doing a higher level work where I'm changing a lot of people's lives at once, or at least I would be after, being in the industry for a bit. And that felt really good. That really hit my morals and my values, and I just had to. And so that it felt like a little bit of calling, if I may, but that's what drew me into healthcare administration after, the trajectory of pre-med. I was like, not for me, but this newfound, I love pre-med, I love healthcare, and I love management. And so this was like a good marrying of the two.
It's really that micro versus macro. I mean, it's the physicians it's so intelligent and so brilliant that they can focus on that granularity of each
Mm-hmm.
individual and each individual metric of that person. And then you have the other end of that spectrum, that macro, where we're looking at really
Yes.
society and systems.
Yes.
And I've said this in almost every one of these interviews I've done, and it's that, I one of the reasons I switched, being honest, is that I was not smart enough to handle some of these courses. And so I would put myself down and say, oh, I'm not as smart as these doctors. But what
Mm-hmm.
was interesting is that when I worked with some of my med school friends who ended up going to med school and they were looking at doing like an MD, MBA, they struggled with some of the business courses.
Yep.
And so it's just finding what we're good at. And that's a lot of it is,
Exactly.
as
And you
pre-med,
need both.
exactly. Yes. And,
Mm-hmm.
it's incredible. And I think this new generation, you might be perceiving this yourself, is that there's been back in the day, 40, 50 years ago, there was these for-profit hospitals that would really abuse their physicians, and it gave administrators a bad name. But with
Mm-hmm.
this new generation, it seems like the med students and the MHA candidates are they're much less at odds with each other. They're
Mm.
having better relationships. Have you found in your fellowship and in your experience that you've been able to cultivate good relationships with clinical staff?
Yeah. So I haven't directly been on the front lines with a doctor or shadowing them, but I have worked with a lot of MDs who are now in administrative roles. And so that might be a little bit of bias, but they're one of, the sweetest people that I've met. They're so, I think it's like an MD thing where you have to explain everything in depth. And I appreciate that so much because as a patient, if someone was doing that to me, I would love that. But also working with them, it's like it's such great communication that they already have. And I have rarely, and I say rarely with like maybe 1% margin, that might have felt bad in communication, like communicating with a physician, but they have always been so accepting. And I think it's also on the part of the administrator and how we're talking. You can't talk with any person, whether that's an MD, a nurse, a fellow peer, whoever it is. When you're talking to someone, you need to talk to them as a peer, not someone that you're talking to or talking about. You're talking with them and approaching the conversation very respectfully, even if it's a conversation that might be like, oh, we need to meet some statistics that we haven't been, or quality metric or budget, whatever the topic is that might be difficult. I think it's the way you chat with someone and you show them, like, no, I respect you as a person, and I would hope that you respect me as a person. This is a problem that is not us. This is a problem that's the outside that we're trying to solve together. And so and I think I've been noticing that, and I've always seen that. Actually, I've never seen someone who's like, oh, why do you not like me, or you just hate me, you're just giving me direction.
Hmm.
And that's not the case. But sometimes you do also have to have thick skin because you don't know what the other person's going through and why they might be saying what they're saying.
Yep.
And so understanding that and asking those questions, like, oh, why is that, what's happening, can I help? I think that's the biggest thing. It's like, what can I do to help? Is there any way that I can jump in and take something off your plate? Because they have 5 million other patients that they need to be seeing. So if there's something that I can take off their plate and work in tandem with them instead of against them, I think relationships are just easily made.
That's excellent.
I've not had a difficult time with that at all.
I was speaking with the CEO of Penn a little while ago, and he said similar things about, it's really coming at people with that level of respect and understanding of explaining to them, like, this is, and for physicians it's a little bit easier because they understand the health system, but there are some people who didn't necessarily want like a job in a hospital, like some of our house staff, which are so dedicated and hardworking. They had experience in other industries before coming on. One of the interviewees that we're having in a few weeks was working in retail for many years, and he got really good at retail management. And then he came on to healthcare, and he's done really well here. But I think it can be challenging sometimes to give individuals with a different background that sense of purpose that
Mm.
we have in healthcare. The CEO of Penn, he does really good at that. He gives a speech to the new employees. He tries to really show them, what we're doing as an organization. What has WellStar done when bringing you on to give you the underlying ideas of why they do what they do?
Mm. So I'm going to ask a clarifying question so I understand correctly. You're asking me, like, what has WellStar shown me about their values and made me understand what this organization is about? Is that what?
Exactly. Yes. Perfect.
Okay. So I think the biggest thing is everybody that I talk to before accepting the fellowship, especially my current preceptor, even during my internship, were just so authentic. And everything they said, it was never like a misalignment. And so it made me trust them. And everything that I've noticed WellStar does so far as an organization and individuals of the organization is all values driven, where I think everybody embodies those values that we have of serving with compassion. Every voice should be heard, and just through and through every single time. And I feel so accepted.
Mm,
And you talked about sense of purpose, and I've never felt like WellStar has shared that sense of purpose, as in told me what my purpose should be. It was always they've just accepted what my purpose is. So they have allowed me to set my purpose and given me the space to talk about it and been like, we accept you. And I think I couldn't have asked for a better organization. And that's something that drew me to WellStar in my internship, even now. And I will continue to speak about this because, a lot of organizations, everyone has their ups and downs, but that, like you said, that sense of purpose needs to be driven by the top. And I think, and then trickle down to everyone else. But I think at WellStar, not only does that happen, but it also goes the opposite way. And I really like that we meet in the middle. There's no true hierarchy or any telling people what to do. It's just accepting people the way they are. And I really like that. Right now in this day and age, it's things are changing so fast. People are growing so fast. Organizations are multiplying. And I think having that sense of belonging and that sense of purpose be people's individuality is what really makes the organization shine. And I think it's going to go a long way for Wellstar.
And so I want to ask about WellStar as well because it's your resume is unique in the way that you are not necessarily an administrative fellow at a hospital, right? You are a corporate administrative fellow. So can you kind of explain to us what that is and what the differences are?
Yeah. So in general, and this is a great question, but Wellstar has four different tracks in my cohort at least. I'm on the corporate track. I have peers who are in the ambulatory care track and then also service lines, which are like our departments like neurology, cardio, etc. And we have operations track who is deployed at a hospital and they're just engrossed with the day to day. With the corporate track, we're kind of just an umbrella track where we can fit into any lane, any part. And that's what drew me is first I was like, oh, I really, really want operations. That's my dream. That's my goals. I love it because I never knew that there was anything else. And then corporate track it was more vast and wide. And it gave you a good snapshot of system level thinking. So Wellstar has multiple different hospitals and marrying all of them together because all of their markets are different. So how do we come up with strategies that are system wide, but for beneficial for all hospitals? So that level of thinking is what the corporate track instills. And for me, I've had a lot of experience, with the typical hospital day to day. I could go to our flagship hospital and do some projects there, but it also gives me experience with like law. I've never been on the legal side of things and I don't have a law degree, nor would I want a law degree, at least now. But I was still able to do projects there and I was able to do projects in HR. I was able to do projects in very niche parts of healthcare that you wouldn't think exists, and it was really great. And I think I made a really good choice. I also made this choice because of my preceptor. I will not lie. Like I told you, I'm very relationship driven, and me and him had a instant connection even in the internship. And he has mentored me and sponsored me in such a way where I knew I was going to be in good hands if he was my preceptor. And so when he offered me that job, I had to say yes. And I was fortunate enough to have that and fortunate enough to be in the corporate track because I was a little unsure. And I think it's a great track for people who might be unsure and don't know exactly which area of the healthcare system they want to fall into. So they can try a little bit of everything in this track, if that answers or helps.
That answers, and that makes a lot of sense. It actually answers some of the other questions I was going to ask. We're going to have to go back a little bit further and then talk about that pivotal moment when you got the internship. Because it seems
Mhm.
like you had that connection in the internship, and that's what led you to go there. A lot of people have this hard time choosing where to go for their fellowship, but it seems like
Yeah.
decision was a bit easier for you. So, what was it like
Yes.
choosing the internship? What led you to do that? Because that was the pivotal moment, kind of in your career, you could say.
It sure was. And I think so. I'm trying to put myself back a couple of years. Internships are required by UNC. So we have a way where a lot of companies will reach out to UNC and UNC will send it out as like a blast to all of their students if these companies are interested, and we can put in our application where we'd like. So that's how it started. Wellstar was a newer one. In my previous cohort, we had two of UNC students who were interns at WellStar. And one of them I'd heard accepted a position for a fellowship there. And so I was like, oh, okay. So one thing was I didn't really know much about WellStar at the time because I hadn't done my research. And so when this came through, I was doing some research about WellStar, and I was like, okay, one, not only do they hire their interns, they're not just taking an intern just to get one, they're actually cultivating a workforce for them. And so that gave me a lot of, security, and they might want me back. And that was really great. And secondly, they were one of the largest systems in Georgia. Like, they were just hitting all the checkpoints. They allowed me a lot of flexibility. They didn't have such a strict program of, week 1 you're going to do this, week 2 you're going to do this. They let you do it at your own pace. So I really like that. And the next thing was just trusting my director. So Jeffrey Sims, who's the director at UNC, he spoke very highly of Andrew. He spoke very highly of WellStar. And, at one point I just trusted him. I was like, let's see where this goes. Submitted my application, really fortunate to get an interview, talked on the phone, or it was a virtual interview, not on the phone, but it was a virtual interview. And, it meant so much to me that in the interview was not just a previous fellow, but it was Andrew there, who runs the entire internship. But not only that, he's a chief of staff at WellStar.
Mm,
And for him to be present at my interview for an internship meant a lot to me.
yep.
And it showed that, not only do they care about me as a person, regardless of what job I'm applying for, but I'm already receiving the respect, that I might not have deserved at that point because I hadn't proven myself. But I had this notion, I don't know what it was. I was like, oh, they're going to be just like any other company. But no, he showed up, he was talking to me. And it wasn't like this, oh, I'm chief of staff. He was so genuine. And I was like, if the chief of staff is like this, I can only imagine how everyone else is like.
Yep. Especially at a system so large, that's really impactful.
Exactly. And so that's exactly what did it for me. And I was like, you know what? Even if it's not the greatest decision, it's only for 10 weeks. So we'll see how it is. And so I ended up accepting the role, and it was fantastic. And at the time I was in operations. So I was at a hospital, Cobb Hospital. And I think that was really great because I wasn't overwhelmed. I had a smaller team that I was working with at the hospital. Not that that hospital is small at all. It's at 328
Oh,
beds,
yeah,
I want to say, if I'm not forgetting.
it's pretty
Um,
good. Yeah.
and so it's a medium-sized hospital, and my preceptor, who was the president at the time, he was amazing. And not only did he allow me to grow, but he also he was a sponsor for me, and he mentored me. And so I couldn't have asked for a better internship experience.
So I'll leave you with one last question because we're trying to keep it under 20 minutes, and
Yeah.
I could just talk to you for like hours. Yeah, I love hearing all this. It sounds, and it's interesting too because I've mostly talked to people in the Northeast, and I'm starting to move into the South. And so the UAB, I met with them, and their program was excellent. Their fellowship was excellent. So I love hearing about this as well, in the Georgia area. So this seems like the South is a real region we need to focus on. But I want you to zoom out for a minute and just to give one last piece of advice. What should other fellowship programs do to be as good as, and not just fellowship, but internship, to be as good as what you've
Mm.
experienced? What is just one thing you think? Because there's so many aspects you mentioned, but what's been the biggest impact?
Valuing my individuality, and I think, and not having me fit into this fellow mold. I think WellStar's done a great job with that. And they really force me to step out and be my authentic self. Because I always want to ask these questions of, okay, so what was done in the past? What did someone else do? And my preceptor's always like, figure it out, do what you need to do. And at
Hmm.
first I was like, I don't know what to do. And it was a little frustrating, but then it has taught me and it's let me grow. And I think with other fellowship programs, it will really do the organization wonders when you let someone flourish like that. And when you let someone just find their path and grow. I'm not saying let them loose and let them do whatever they'd like. Definitely have some reign, some boundaries, but giving them a little more ownership was something that really mattered to me.
Do you think that would solve a lot of the diversity problems programs have? It seems like I've heard from some fellows that they felt uncomfortable because all of the fellow applicants were very different than them. They were all kind of the
Mm.
same people from the same schools, or they were all the same race, or they were all the same gender, and then they were the odd one out. Do you think if we appreciated individuality more, that that would solve some of the diversity issues? How has it been
Yeah.
there? Has it been a diverse, accepting experience?
Cool. You're hitting this right on the mark. So, my biggest reason was the person before me was exactly like me. I'm not saying demographically, but she was a woman of color, very strong, established, and I loved it. And my cohort, if you see, we're all women of color
That's nice.
who came from everywhere else. And when you see, at least when I see us standing in a room, I think it gives me so much more, like, it makes me stand up a little taller. And I think that might be it. I can't say, but for me, it has made a huge difference
That's
to
incredible.
be valued with all of my intersectionalities and all of my, whatever you wanted to call. I can't think of the word, but yes.
Yeah,
In short, yes. I think it would help a lot of folks come out of their shell and really understand that they are accepted.
that's excellent
Um,
advice. Thank you so much for sharing that. And
yeah.
thank you so much for coming on. I'm so glad you've had a great experience with your program, and thanks for sharing that with our audience.
Thanks for having me and giving me this platform to talk about how wonderful it's been.
Of course, of course. We couldn't do it without you, and we want other fellows to look at that program and hopefully flood them with applications. So
Yes, absolutely. We would love to have that. And I think WellStar would be fortunate to have all of these applicants as well. It's a two-way street.